Welcome to episode 6 of COVID-19 and Engineering series exclusively from our AHAR Consultants YouTube channel. We will be continuing with ASHRAE's Epidemic Task Force recommendation on office and commercial buildings. In our previous episode, we have reviewed about indoor and outdoor environment and discussed about the air conditioning systems in this building. Currently in Malaysia, there is insufficient emphasis on engineering control, particularly looking at ACMV systems in buildings. As we know, COVID-19 is an airborne virus as mentioned by the WHO. Using engineering control, we can separate people from these pathogens. So far, nobody is talking about preparing our offices, schools, universities, or commercial centers to cope with the virus transmission. Picture in this slide shows a typical ceiling cassette installation at a shopping mall. As you can see, there is no fresh air intake into the space. The unit is only circulating the air at all times. In this episode, we will discuss about using pressure controls in reducing the potential exposure of humans to harmful pathogens in the air. Air change rate is the amount of air added to or removed from a space over a period of time. Higher air change means more air is circulated in space, as it is important to avoid stagnant air for long hours. Stagnant air can hold contaminants like airborne pollutants and viruses such as COVID-19 at high concentrations longer, which will increase the possibility of infection to the occupants. Air change relates closely to room pressurization. In Malaysia, there are many code requirements for air change that we should abide. One of the main requirements that buildings should adhere is set in the Uniform Building Bylaws 1984 and Industrial Code of Practice on Indoor Air Quality by the Department of Safety and Health. Other than that, we also refer to ASHRAE standards for indoor air quality and ventilation for healthcare facilities as shown in this slide. One key pressure control element is cascading pressure control, where the air flows from clean to less clean spaces. In office and commercial buildings, ASHRAE recommends maintaining a slightly positive pressure inside the building compared to outside. In spaces where infected people may be present, ASHRAE recommends shutting off return air to the central air conditioning system and use exhaust fan to discharge the air outside discharge air outside away from public spaces, outdoor air intakes, and operable windows. This is an example of a typical neighborhood clinic that we usually visit in shophouses around Malaysia. Most of the time, the reception counter is nearest to the front entrance, followed by the medicine collection counter, then the doctor and treatment room, and finally the stores and the toilets at the back. Patients coming for treatment will enter through the front entrance and wait at the waiting area. They bring along pathogens from their illnesses. To reduce the infection through air and protect the doctors and nurses, the air should flow from the highest pressure zone to the lowest pressure zone. Exhaust fan installed at the rear entrance will create a low pressure zone at the waiting area. This will create a pressure gradient between the doctor's room and the waiting area, resulting in air flowing out of the doctor's room into the waiting area. Makeup ventilation air enters through the fresh air intake duct and into the doctor's room. Pressure between doctor's room and the adjacent collection counter can also be controlled by controlling the amount of makeup air entering the space. Care should be taken when installing exhaust fan at toilet louvers, as this will result in air short-circuiting and pressure differential will not work. An example in the picture below. Building enclosure must be properly sealed in order for pressurization to work. Do consult your engineering professional for advice before installing your exhaust fan. Pressure levels between adjacent spaces can be monitored using a pressure monitoring device. This pressure monitoring device can be of analog type or digital type, as shown in slides below. Perhaps this is a good time where buildings should be equipped with revolving doors as a new norm. Revolving doors not only ensure pressure differential can be maintained, but also prevents contact between people entering and exiting the building. Automatic revolving doors also reduce possibilities of people touching the door handles. Caution should be taken when going through airlocks by allowing some social distancing to ventilate the air after a passage of a person. That is all from me today. We hope that this sharing session will benefit more people and create awareness on the action to be taken in building design and operation to ensure safety of the occupants. If you found this very helpful, be sure to hit thumbs up below. If you are new to the channel, be sure to subscribe and turn on notifications. Till we meet again in the next episode. Bye bye.